Crohn's disease is a type of autoimmune disorder. So it's your body's inability to function properly. I was diagnosed with Crohn's disease when I was 19, but I actually started experiencing symptoms as early as 15. When I finally got my diagnosis, it was a bit of a relief, but also this understanding of, wow, this is some big thing that I'm going to have to live with for the rest of my life. And I'm going to have to be prepared to do that. It really does impact every aspect of your life. You have to deal with a lot of fatigue and weight loss and brain fog.
Good afternoon, everyone. My name is Trevor Zylstra, and I'm here with the One Moment Podcast team with Kevin Odom and Miss Angela Tipton. And we're glad that you're here with us today, and we expect to have a great conversation with Miss Angela.
Great to be here. Thanks for having me.
Absolutely. And thank you, Trev, for opening us up. Thank you, Miss Angela, for being here again. Yeah, and I definitely would have to say that today's episode is not probably going to get into any type of suicide prevention, however, or substance use. However, if you are triggered at any moment during this episode, please reach out immediately for help. You have 988, which is the National Suicide and Crisis Hotline. You also have local crisis centers and local emergency departments that you can also seek help from. And you also have, of course, 911, which is the local emergency number. Please utilize resources that are life-saving and are life-critical. Now, I want to get into, you were telling me before the show that you are diagnosed with Crohn's disease. And I'd like to know, my first question is, how long ago were you first diagnosed with Crohn's disease?
Yeah, so good question. I was diagnosed with Crohn's disease when I was 19, but I actually started experiencing symptoms as early as 15. So it took about 4 years for me to get a diagnosis, which was a journey in itself. It was very hard to get a diagnosis. I knew that something was wrong with me, I just didn't know what. So when I finally got my diagnosis, and it's been, boy, almost 20 years since then, it was a bit of a relief, but also this understanding of, wow, this is some big thing that I'm going to have to live with for the rest of my life. And I'm going to have to be prepared to do that. So, yeah, it was quite some years ago. And I've had my ups and downs over the years, but I've learned to manage it and deal with it. And sure, it's presented struggles, but it's also given me some healthy perspective in life as well.
That's just interesting. One of the first things I need to make sure that I'm capable of hearing, I'm a little bit hard of hearing. Is it CROMS or C8 or KROHNS?
Crohns.
Crohn's. Okay. Yes, ma'am. Now, I'm not very familiar with that. I'm kind of familiar with it, and they talk about it on a lot of pharmaceutical advertisements on the television. But can you give us a little bit more background about what that actually is?
Absolutely. So, Crohn's disease is a type of autoimmune disorder. So, to put it really simply, if you're not familiar with autoimmune disorders, it's your body's inability to function properly. It's your body is attacking your own system. In my case, with Crohn's, it means that my intestines are frequently under attack by my own immune system. And Crohn's disease is a type of inflammatory bowel disease. It's one of two types. It's frequently referred to, very simply put, as the bathroom disease. And it is oversimplifying it a little bit. A lot more goes into it than that. But yes, it is common to have to dash off to the bathroom, to have issues with it, things like that. But there are other implications as well. It means you have to deal with a lot of fatigue and weight loss and brain fog and so many other things. So again, just calling it the bathroom disease is oversimplifying it. Yes, you
Over.
do spend a lot more time in the bathroom probably if you have Crohn's, but it really does impact every aspect of your life. And for me to maintain remission and to be healthy, I do have to be on a pretty rigorous treatment regimen that helps me maintain my life as it is. And my life would otherwise be very impacted if I didn't maintain my treatment schedule.
Absolutely. And thank you for explaining that for us because that helps me gain better insight into it because I've heard about it for so many years and you don't even get a general description of the problems with the disease on the advertisements, especially when they're promoting a product that's supposed to help that issue that you might have. Um, you said something about brain fog. Now that to me is a very interesting thing because does that necessarily mean that your brain isn't functioning properly or that your brain is reacting to the symptoms that you might be going through?
Yeah, it's really just a reaction from the symptoms you've had. And I'm speaking from my own personal experience where when I've had periods of flares, there've been days, truthfully, where it's been a struggle just to even get out of bed, where you feel just this really intense pain, where doing normal day-to-day tasks, like even simply taking a shower, can feel like a really big chore. So, yes, alongside that, you have this really bad fatigue. It can be really hard to focus. And I'm a very career driven person. There have been times where I had a difficult time just getting through my workday, completing what would otherwise be very simple tasks like following through with emails or Excel spreadsheets or whatever it was that I was working on at the time. So it is just one of those things that it carries over into every aspect of your life, or it can if you're in a position of being in a flare where your symptoms are not as under control as they ideally would be.
Okay, well, I'm glad that you could clarify that for us. Uh, Kevin, what are your thoughts right now?
As you were sitting there describing the brain fog, my first thought process is it goes back to what I've been experiencing since I was last sick with COVID. I call it COVID brain. I'm not even going to lie. Just like I couldn't think of that word retreat earlier, that's literally COVID brain for me because
Mhm.
uh, I literally read the website, read the dates, saw everything, but I could not think of that word. And for me, that I mean, it's gotten better since I've been sick, since I've not been sick, but I still struggle with it. And it's just
Sure.
that healing process due to COVID. I mean, had a flare up with coughing yesterday, the first one in all week. And so, but it took me 3 weeks of coughing before I could get to that point. And I struggle less with the brain fog piece or that mental blank spot, as you know, it could be described. So I appreciate you sharing that. Now, I do want to know because we're talking about Crohn's, we're talking about a medical diagnosis. I want to kind of throw in some mental health here and get your feedback on it and maybe some of your experiences with it. Is that okay with you, Trev?
Yeah, yeah, absolutely.
All right. Current research suggests that depression affects up to 20 to 30% of individuals with Crohn's disease. Anxiety disorders are seen in 25 to 40% of Crohn disease individuals. Uh, Stress and emotional distress is common during flares, can lead to avoidance behaviors and reduced motivation for self care.
Mm,
Post traumatic stress disorder, also known as PTSD, is less common but significant, may increase flare risk and worsen long term outcomes. And then when you look at the cognitive impairments, as you said, reported in up to 37 to 50% of active Crohn's, Crohn's disease cases, it impacts work and relationships. So you already spoke about the cognitive fog, right? That Crohn's brain, right? For short. What about anxiety? What about depression? What about PTSD? What has been your experiences in those areas, and including emotional distress?
That's a great question. And I can admit that I have been prone to those, all of those at some point or another. I have struggled with depression. I have also struggled with anxiety. And yes, I have struggled with what I would describe as more complex PTSD as well. So I am not immune to any of those things. And I would absolutely agree that those things do correlate. And I can explain from my own personal experience what that's been like when you have this dawning realization that you're in this situation that you can't control, that you are beholden to your doctors and your treatment and insurance in some cases. I've had some struggles with insurance too. Those are things that really put you in a situation that is extremely frustrating, to say the least. And at a more extreme side, it can be extremely distressing if, for instance, and I've experienced this, where you're having issues with your insurance, where it's not improving your treatment when it needs to, that can lead to delays in treatment, which then can lead to an aggravation of your symptoms. And that can lead you down this rabbit hole of increasing depression, which then aggravates your symptoms, which then increases your depression. And it can be this really bad cycle. So, absolutely. And I do know from my own personal experience that stress, absolutely, not even a question, aggravates my symptoms. So, when I'm struggling with things like depression, anxiety, if I get myself caught in the cycle, it is extremely hard to get out of. And it can be hard to break that cycle. And I have sought support from mental health support, different therapists in my life in the past that have really helped me break that cycle and get the support that I needed as well to get free from that. And what I have learned is that the most important thing is to maintain my schedule of treatment as much as I can. I mean, I can't control doctors, I can't control insurance, but I do everything that I can to advocate for myself, speak up for what I need, be honest about that. And if I'm not getting what I need, be the squeaky wheel and be really loud about it until I get what I need. And then I can get into a good place. And it's frustrating to have to do that. Unfortunately, that's the reality of our healthcare system today, that you have to be that squeaky wheel. You have to be the loudest person in the room sometimes to get that care that you need to help break that cycle. But there are a lot of mental health implications for sure. To be honest, when you said those figures, I'm actually a little surprised that they're not higher than that, because I think that I would I'd be surprised if more people actually experience those kinds of or did not experience those kinds of symptoms, because I think a lot of times when you're dealing with a chronic illness, those things really do go hand in hand. And I've heard that from others that have Crohn's as well. But I don't have the data and insights that you have. So, but that's interesting.
Well, I appreciate it. Thank you. And it sounds like it to me that I am also surprised that it those numbers are not higher. So I do have to ask, because you said a regimen, and then I'm gonna throw it back to Trev. I'm curious as it relates to etiology and pathophysiology, what role does the gut microbiome, if I pronounced that word right, play throughout this Crohn's disease thing?
Yeah. Great question. And it's funny that you asked that question, because this is actually where a lot of my background in my career originated from. In fact, one of the reasons why I got into the field I did originally is because I was very interested in understanding more about Crohn's and what causes it or what aggravates it and things like that. So the one thing I can say is that research is really, really early. So there hasn't been 100% perfect tie that says the gut microbiome has, with 100% certainty, an impact. I think many of us know, many researchers know that there's some sort of a link. Most of the research that I have followed in the past, when I was working on my bachelor's degree, for instance, was a lot more focused on trying to find a tie between specific pathogens that would cause these diseases, and there just wasn't a very strong link there, or they weren't able to find one very well at the time. But that said, that research in more recent years has been expanding and it's been growing, and there's been increasing awareness of the gut microbiome as a whole, which has been found to be linked to all sorts of actually different disorders. As of the last I looked, I don't think there was a direct link that I had found in the research with Crohn's, but again, there is strong evidence that suggests that there is a link there. And I think we're going to continue to find that link increasing over time. And I think that as that awareness increases, as our understanding of that research and those specific impacts increases, I think there will be better treatment options. I think there will be better probiotics, for instance, could be just one very specific way of improving those conditions for people. So I do think that there's a link there. It's, again, the research is still kind of early. Nothing says with 100% certainty that, yes, this absolutely causes Crohn's. The one thing that I do know, and having studied this research, is that there has been a link discovered with the immune system function as a whole. So if you imagine your immune system working like a dial, it could be a thermostat in your house, for instance. Those that have Crohn's disease have that dial turned up too high. So if you can regulate that dial or find a way to regulate that dial and turn it down, you don't want to turn it down all the way, because if you turn it down all the way, then your body's not going to be able to take care of any infections and things like that. But if you regulate it just enough, then you can manage. The idea is that you can manage the disease as a whole. But again, that research is still pretty early on. There hasn't been anything that has said that, yes, with this treatment at this dosage, this will absolutely do that for all of these patients. It's too early to say that at this point, but I think in theory, in the next 5 to 10 years, I'm optimistic about it. We might at least learn more and potentially have a treatment option like that that helps regulate it better. But the treatment options on the market today are substantially better than what was available just when I was diagnosed. It is really reassuring to see that there's increasing awareness of that and more treatment options than were available in the past.
That's very interesting, Angela, and we thank you for sharing as much as you have already. And I'm learning as we go, because I like learning every day. But at the same time, it's amazing to understand that something affects you in such an expanse of your entire body, from your head and your brain all the way through, and to be able to be adaptable to a new lifestyle than that what you once learned before is a really an amazing feat for an individual that's going through Crohn's disease. I'm completely unaware. Now, I shouldn't be, because I'm cognitive of a lot of medical things, but with Crohn's disease, I didn't realize how impactful it is. It is very serious, and you're talking about a gut biome, and I'm like, wow, this is just opening up, like peeling back the onion, generally, of just being able to learn, and how much has to be learned and done for people that suffer with this condition. And for me, I'm just curious as to how you were able to go through this, and what kind of sources that you use to help strengthen yourself to keep moving forward in the progress of it while you're trying to heal from it, plus doing work, plus doing uh, house stuff. I mean, it is really overwhelming to me. Just like, wow, this is like huge. So in the general aspect of it, for you, what were you able to use to help you uh, discover a new adaptability for yourself?
Yeah, a great question. So I have always been a very ambitious person, and I am a go-getter. I am not one of those people that can just say, forget it, I'm not going to go after my dreams. I've always been very goal oriented, and I've always had these dreams and goals for myself. That said, to your point, yes, I've had to build a sort of a system around me to support me in that, because I will say this, having gone through this experience a few times, if my health is not in a place where I need it to be, everything else around me suffers. At that point, I can't do anything else. So I do have to prioritize my health. And for me, that looks like a few different things. For one, making sure that I'm in close contact with my doctors and I'm maintaining my treatment schedule. That is I, everything has to come first. I have to prioritize that above everything else. I've had to prioritize that over work. I've had to, as awful as it sounds, I've had to prioritize that over my children at times, which has been incredibly difficult to do. But the reality is if I'm not making that the number one priority, everything else around me will suffer. So, yes, I've had to drop other things to make sure that I am getting my treatment when I have to get it. So, other things have had to fall in place of that. So that is one simple thing, but a lot can happen behind the scenes to make sure that that's happening. The other thing too that has really played an important role in my life has been mindset and my mental health. And that's something that we talked about a little bit already, but as I've already pointed out, stress is one of those things that really does aggravate my symptoms. And being a very ambitious and goal oriented person, naturally, I tend to deal with a good amount of stress. So I need to find a good way to balance that, to counteract that. And so a few things I've done with that. Yes, I've gone to counseling, which has been immensely helpful. But I also really prioritize doing what I can for my mindset and then also what I need for my own self care. Ironically, self care was not something I was very good at when I was first
Right.
diagnosed. In fact, I remember to this day, I still remember having a conversation with my husband, who actually is also a counselor. And he said, you need to do more for your self care. And at the time, I remember thinking, why? It doesn't matter. It's funny how you find out later. Years of
Right.
wisdom,
Right.
you realize that, oh, actually, there's something here that I need to pay attention to. But I have my own self care routine, and that looks very different for me than it probably does for some other people. For instance, what I do for self
Sure.
care is yoga, meditation, going for runs, things like that are important for me to maintain, and they help me maintain my stress. I also really love reading different books to help me increase awareness of my mindset or explore different concepts that maybe I didn't think about or that I wasn't initially aware of. And I've always been a very curious individual by my very nature. So I like to question the things that I think I know. For me, it's kind of a challenge. I don't mind
That's
challenging
that's
my beliefs.
amazing.
Yeah,
That's
and it's
amazing.
helped me a lot. It really has. It helps with my mindset, helps with my self-care. That doesn't mean I'm not initially resistant when someone says you need to do more self-care,
Right.
but I do try to approach those things with curiosity, and that has helped me quite a bit.
So on the on another aspect of that is you said mindset quite a few times, and I get it because you're actually fighting a battle. So what did you have to do to stay like in one of the most elite uh, armed forces in the planet? They always say stay motivated. Like, what was your motivating thing to do to keep you going, to keep you staying motivated? How did you change your own mindset?
Yeah, yeah. So great question. So I started to realize that I had certain beliefs that were hindering my progress, and I was not immediately aware of them for sure. So I went through, and this was not an overnight thing that happened at all. This was really a
Right, it's
years long
progression.
journey
Sure.
of where I approached my own belief system with curiosity. And I realized that there were certain beliefs that I had about myself, about others, about the world that were helping me move forward the way that I needed to, but there were some beliefs that were holding me back. And I'll just give you one very specific one um, that center around my money mindset. And one of those traps that I found that I was falling into frequently was I've always had this belief that you had to work really, really hard to make money. There's some reality grounded in that. You don't just make money sitting and not doing
Right.
anything, but that it did help me in my early career to really help me build some momentum and get some success. But at a certain point, it actually started getting in the way of my own progress because I started overworking. I turned into a workaholic. And then I would fall into this
Done
trap
that.
of overworking myself and then falling into a bad state of mental health. and then that cycle would perpetuate itself. So it was uncovering beliefs like that, realizing that, okay, this is interesting. Approaching it with curiosity, not any shameful beliefs
Right.
about that, because it came from something that was reasonable at the time. But I realized that, that belief is not serving me, or it's not serving me the way I need it to. So I started to develop systems around those things to help me maintain a belief system that was supporting me and helping me stay motivated and maintaining a healthy mindset and a positive, or more positive mental health state as well. So that's an ongoing thing. It's that belief that I
Right.
have to work hard for money is one of those ones that actually sneaks up on me fairly often if I'm not careful, if my self-care routine is starting to suffer, if I'm not doing the things that I need to do. So it's not that I just immediately fixed it overnight. It is one of those things that I have to continue revisiting over time.
I exactly understand that, because you have to have an open mindfulness, an open mindedness of your own mind,
That's right.
and what's going to be positive for you and what's going to be negative. So that was a great answer to that question of mine. And it's like mind blowing to me to realize how much work you really have to do to maintain just a base foundation for a daily continuous to move forward. And that is great. That's beneficial to everyone that is listening to this podcast, or hearing it, or however. I'm just that's, to me, is like great news. And I'm glad to see that you continued on moving forward. You're a great example to get through this, or anyone that's not really familiar with what's going on with themselves right now.
Thanks.
So I'd like to know, and I want to shift the topic to here in a bit to motherhood, but
Mm.
I would like to know, as far as the Crohn's disease, w- what was its impact on you when you were first diagnosed versus now, and how has it impacted your relationships with your family over time?
Yeah, good question. So, for sure, I was in a much different place in my life when I was first diagnosed compared to where I am today. So, when I was first diagnosed, it was for me one of those moments of relief of, hey, I have an answer at least. So I know what's wrong with me. I can fix it. That's great. But at the same time, I didn't really know what I was getting into. I knew that it was something I was going to have to deal with, but what specifically that meant, I didn't know. So I kind of stumbled my way into figuring out, okay, I need to keep in touch base, or keep closely in touch with my doctors, and really make sure I'm maintaining that treatment schedule. There were times where I was in remission, and honestly, I forgot what it was like to feel sick. So it was easy to start thinking that, oh, maybe I don't need to worry about it that much. Maybe the false belief of maybe I'm cured, and maybe I don't have to worry about it. But of course, I learned the hard way that no, you can't do that. Otherwise, you slip back into the state of not being healthy and being in the place you need to be in. Now, years later, I've learned very well by now that no, you don't touch that at all. You have to be really careful about maintaining that schedule, because yes, for me, the consequences can be very severe, and everyone's a little bit different. Those that have Crohn's are a little bit different. Some, they have a little bit more flexible depending on the severity of your symptoms. It presents differently in different people. Some people are in different treatments that work better for them, and so on. I am one of those where I am, and I've learned that I'm highly sensitive, that if I mess with my treatment schedule by even as much as a week or as little as a week, that can have a severe impact on my symptoms. Now, some people, they can give a little bit more. Maybe they can go a few more weeks, or maybe they don't have to be on the same kind of treatment. They have a bit more flexibility. I am not fortunate enough to have that, unfortunately for me. But that is something that I've learned later on in life, having dealt with this for so many years, that you don't mess with that, that you're very careful with that, you maintain that. From a mindset standpoint too, yes, I'm I'm in a different place in my life where initially I'd say I experienced symptoms of, well, experienced beliefs of denial, like that early belief of, oh, maybe I'm cured and I don't have to worry about it. There was that denial. I have long come past that, and I'm way further into the acceptance place. Acceptance is one of those things that for sure in my earlier adulthood that I struggled with a little bit more, but I also learned that trying to fight something that I can't control is not healthy. It's not something that's going to help my mindset. It's going to be very costly to my mental health, and that too can lead to a spiral that then leads to my symptoms being more out of control, and then everything else falls apart from there on. So I've learned better how to balance those things and those needs, and it starts with me just being on top of my treatment and doing what I need to do today. And with it being a non negotiable and understanding that's a non negotiable later on in life, it's much easier to prioritize. It doesn't make it easy to prioritize all the time. It's still one of those things that I have to struggle with and have to balance with the rest of life demands. But I've learned that it's important that I do that so that I can maintain my health the way it is.
And as far as that went, what effect did that have on your family life?
Yes, thank you for bringing me back to that. Yeah, it has had a profound impact on my family life. And earlier on, when I was first diagnosed, I was still living with my parents. So my family has since transformed, where now I have my own family and my own
Right.
children. And one of the things that I learned in earlier adulthood is that there were certain relationships in my family that were just not very healthy. So I had to build some distance between some of those, and that was challenging in itself to do that. But I had certain family members that were getting themselves in this trap, this mindset trap that I found that I could very easily fall into as well if I followed their example. And so I learned to develop some healthy boundaries with some of those individuals that to some degree I've maintained today, at least to the degree that I've needed to. And today, my family looks very, very different. Of course, I have my husband and I have my children, and they have all learned from really years prior of seeing me struggle with my illness that there are certain things that I just cannot give on. And one of those things is my treatment schedule. And they're actually my family is very understanding. They understand that, hey, if something disrupts my treatment schedule, if I'm not feeling well, mommy needs a few minutes to lay in bed, or maybe I need some extra support from my husband to take care of some of these other things so I can get back to a place of having my self-care routine, of having my mental health, whatever it is that I need in that moment. And
Sure.
that's something else that my family has done a great job of helping me balance is that self-care routine. So, for instance, my husband will watch the kids when I go to yoga or I go for a run or whatever that is. And I find that we have a really good dynamic. We have really good balance in our family. And it starts with honestly just being open and transparent about what we need and communicating that. And I feel like at times that I almost over communicate. I think sometimes we're overly honest in my family, but it helps us all stay on the same page and understand that, hey, this is what we need. This is how we maintain our lifestyle. This is how we maintain our happy family, keep our routines and all of those things. So it's definitely changed a lot, that those family dynamics for sure in my life.
A lot of people wouldn't consider how much a simple thing, eh, being diagnosed with something, all of a sudden your whole family has to adapt a little bit in a positive way to help either take care of you or to help you take care of yourself. So it's really important to make sure that there, like you said, that there are certain boundaries that are non-negotiable. And that to me is really encouraging because respecting each other's boundaries at all times is a productive process. So it's just it's really encouraging to hear how much your husband and your children have adapted themselves to help you adapt. It's teamwork and teamwork to get
It is.
through when you get diagnosed with something like this. So thank you for sharing that with us. Go ahead, Kevin. You're
I appreciate it. Yeah, I was only going to say something. Being motherhood, right? Raising two kids, currently pregnant with a third, and about to give birth next month. It's sounds like Crohn's disease, as Trevor was just reflecting back to you, has had a significant impact on your life. So I'm curious, okay? I'm curious because we've spoken about Crohn's disease with no pregnancy, just on the motherhood. So tell me about the pregnancy and Crohn's.
Yeah, so good question. I'm definitely not the first and won't be the last, I'm sure, mom to be pregnant while having Crohn's. There are certain things that I have to do that are a little bit different than other moms that are pregnant. For instance, I get treated regardless as a high risk pregnancy. So that means for me, I get more ultrasounds, more doctor's appointments, things like that. I have been fortunate enough to have, despite my illness, actually very healthy babies, very healthy pregnancies. One of those things that you
That
may
is
not
a
often
huge
think
blessing
about.
right there. Boom.
It is. It is. Oh, yes. I'm incredibly fortunate. I'm very blessed in that sense. So, absolutely, I agree. One of the things, though, that I do have to monitor or account for is my treatment schedule. So this is one of those areas that can be a little bit of a challenge and something that in a normal pregnancy you wouldn't think about. But so I'm on the cycle of getting my treatments now every 7 weeks, but the downside to that is that it is one of those things that my babies will also get. Now, there have been some studies that have shown that there really aren't any long-term health effects for babies that have had moms on any sort of treatment. The risk factor, though, is that it can make my children more prone to infections because my treatment by default, by its very nature, what it's supposed to do, does weaken my immune system. So one of the things that we have to account for as much as we can is try at the time of my children's birth, try to make sure there's as little of that drug in their system at the time of birth as is possible. So that means I do have to make some slight adjustments to my treatment schedule within reason. And I do have maybe a few days, maybe up to a week of some flexibility here and there. So I have done that where up until my due date, there's as little of that drug in their system as possible. So for instance, my last treatment will be roughly 7 weeks before my baby is supposed to be born. It's not a perfect system, and sometimes there are challenges with that. I try to schedule that out as soon as I know that I'm pregnant, essentially, so that I can account for that and I don't have to make drastic changes to my treatment schedule because even 2 weeks for me can have a profound impact on how I'm feeling. So that is one thing that's a little bit different. And my doctors very closely monitor my pregnancies to make sure that everything is progressing as healthily as needed. And as I mentioned, so far, everything has worked out really well, which I've been very fortunate and blessed to have.
Wow. That to me is just a really amazing accomplishment, especially because here I am just discovering that you're due pretty soon. I'm like,
Yep.
whoa, dude, she's really rocking it. She's totally the rock star. So,
Yeah, no, I am ecstatic over her resilience, and I don't even want to say resilience, her
I mean,
strength. I think
you have
strength
to,
fits
because that's
better.
huge resilience.
Yeah,
Huge.
absolutely, absolutely. I mean, when you think about, just not just being pregnant, raising two kids. Okay,
Mm-hmm.
I'm not. I'm gonna say three kids. Okay, raising three kids, pregnant with the third one, and you know where I'm getting the
You know what I
third.
feel like saying? I feel like saying, I'm not worthy. I'm not worthy. You know, if you know the reference to
Right,
that, then I'm like,
right.
man,
No,
you really are a super, super rock star for what you're doing. And if I had my hat on, I usually have one on, I would tip my hat to you, ma'am. That is
yeah,
astounding.
that is awesome. And just so you know, the third kid, when I say you're raising three children, that's the husband.
And that happens at times too.
Right, right. Oh, wow. No, that is so. What has been the biggest challenge? Uh, yeah. Let me ask that. What has been the biggest challenge with motherhood and parenting and Crohn's disease? What do you think in your experience?
Yeah, I'd say that the biggest challenge for me has been, for me, it's been more on the mental side, and the physical side comes into it. So let me explain where I'm getting at. When I've had issues where my health isn't where it needs to be and I'm experiencing a lot of pain. I'm having trouble getting out of bed. In fact, I still remember an experience to this day that stands out where my second child needed a change and I had to dash off to the bathroom and I just felt awful having to do that. For me, the challenge with that, when I'm having those really those symptoms that are I'm struggling with, the challenge has been is that I want to be there as a mom. That is my job. That is my reason for being. They're the center of my universe. They matter more than anything else. And so it's been a struggle for me to have to realize that in order to maintain this world and to keep things the way that they need to be and to stay healthy as a family, I sometimes have to prioritize myself first, and I don't want to do that. That's not my default. My default is I want to go to my children first. I want to prioritize their needs. But the reality is that sometimes I have to prioritize myself first. And as a mom, and I've spoken to other moms about this too, that is not our nature to do that. You want to prioritize your children first, but if you're going to be a good mom, if you're going to be a healthy mom, if you're going to do all of the things that you need to do, sometimes you have to be number one and you have to account for that with your mindset as well. You have to realize that, okay, this is a time where I have to be number one right now. I want to put my children as number one in this moment, but right now my child has to wait for a diaper change so I can run off to the bathroom, take care of this, and then I'll come back. And, waiting an extra few minutes for a diaper change is probably not the end of the world, but I've had to make adjustments for things like that. And sometimes they're small, where maybe it's just an extra few minutes for a diaper change. Sometimes they're a little bit bigger, where, maybe I need the day to just rest or see my doctor or do something else or take care of myself, whatever that looks like, and I need someone else to watch the kids for a little bit. And it's not an easy thing to do. It's not what I would prefer to do as a mom, but sometimes I just have to. And that's been probably the hardest thing for me is to realize that, okay, this is not exactly how I want it to be right now. But in order for things to be the way that I want them to, the way that they are most healthy, this is just what I have to do.
Keeping yourself on a high level of self accountability has got to be one of the most extremely difficult tasks to accomplish. And here you are rocking it out. And that is, with me just saying those words, is just a simple explanation of something that is so important because every mother on the planet seems to be, they should be focused on their children first. But yet you have to be cognitive of your own issues to say, okay, there's things going on here. I'm going to get through this to get back to my kids. What a huge, I mean, I'm like, whoa, it's so big. Like, how is she doing that? So just the minimal words of rock stars, like, itty bitty. My hat's off to you once again, and definitely a salute to you for everything that you've gone through and still are going through, but you're developing yourself, and that to me is an amazing accomplishment in itself as well. So, pardon me for interrupting, but I've had to get that off my chest. Kevin, if you want to go ahead and continue on,
I was
awesome.
just
It's amazing,
thinking,
isn't it?
right. No, no, 100%. Because when you think about that's 4 full-time jobs she has. And I
Mm.
say 4 full-time jobs because she's got a career, right? You have your husband, you're a parent times 2, right? But we're just gonna throw it under 1. and then you have your Crohn's disease, which is 4.
Hold on,
So
there's
you
another one.
literally have
There's another one. Do you know what it is, Kevin?
the pregnancy.
No.
Are you talking
Besides
about
that one, even, it's being a mom. Moms are hugely responsible. There's like housework, there's meal preparation, there's so much involvement. A lot of people just aren't cognitively aware of simple things like that. But that's why
well, and
that's why I felt
I was
that's why I
throwing
felt
all
so
of
led
that
to
on.
okay under the bus of one of the jobs. I get you. I'm
No, 100%. You're right. And I was including that under parenting, right?
okay.
Because a lot of people think that, and I've worked with a lot of women, and maybe I want to get your thought process on
Right.
this.
I just didn't want there to be any diminishment for motherhood itself, as including the parenting part is one thing, but yet there's way more aspects of it, vacuuming and
Oh yeah,
house
no,
duties
no,
and things like
a
that,
hundred percent.
that
Because
is a whole other job in it of itself to me. So my
no,
understanding too.
Trevor. So I think you're right, and I want to get her feedback on this because I work with so many women. I've worked with many women. When you ask them, "Are you employed?" No, I'm a stay-at-home mom. Well, okay, that's a full-time job. So we're going to say employed motherhood or parenting or what have you. However, we're going to have to write it on this sheet. And I think we need to restructure the concept of motherhood from I'm a stay-at-home parent to I'm employed. I work full-time. I work sometimes 120 hours a week or whatever the number of hours there is in a week because of my children. And I liked your take on that from a female perspective and a parent, more so a motherhood perspective.
Yeah, so I absolutely agree. There's a lot that goes behind the scenes when it comes to parenting, from the housework to scheduling appointments to making sure the kids get to school, you name it. The list goes on and on and on. So I am in a very fortunate position to have some really fantastic support. So honestly, there's no way, or I can't imagine a way that I could possibly do it all on my own without the great support. And that really starts with my husband and my partner first and foremost. He is a great partner. He's a great dad to our children. We balance needs like housework and child drop-offs at school, things like that. So he is a fantastic partner in that sense, and I simply could not do it without him. My mother-in-law and my aunt are also incredibly supportive. And in addition to those sources of support, we have other support that comes in as well. For instance, we have an occasional house cleaner that comes in and helps us just maintain those standards because we are extremely busy. I work full time and my husband works full time, and we have our family. And then on top of that, I also have my side hustles and the Crohn's. So it's a lot of stuff for us to
Hmm.
balance. So we do bring in that support where we need it. And then we'll get the occasional sitter that will do things like a date night for us and things like that too. So really building in those pillars of support has been really impactful for me and my life and for our family life. And it really helps us build a system of what I would call success. And that doesn't mean it's perfectly in balance 100% of the time. Sometimes certain pillars will start to crack or they'll start to break and we have to rebuild those. But it is one of those things that we continue to maintain and have that support around us. And it makes an immense difference. And I know that I am very fortunate in the sense to have the support I have. I know that there are plenty of other mothers and other parents out there that don't always have that support. And I hear stories about it all the time. And I really feel for those families because when you're in that position, and we've been in that position in the past before too, during COVID, for instance, we struggled to find the childcare we needed. It's
Sure.
very, very hard and other pieces start to falter. So it is so important to have those pillars around you and to have that support system around you. And not everyone can have that kind of access to it, but it's one of those things that we as a family have worked on actively managing and maintaining and rebuilding and fixing and whatever we needed to do on an ongoing basis.
What an absolutely creative story. And I remember when we first started the episode, you talked about building a support system, and I'm like, how in the world does she do that? And and yeah, that's really a courageous, open uh, admittance to accepting things the way that they are. That was a topic on another thing that I related to today was acceptance. And in order to progressively move forward, what what began your process of the acceptance part of it? What was it, a spiritual thing? Was it a mental thing? Because you mentioned something about your mental health too was affected. So this is a full life encompassing thing, and you still have to adapt some way to continue on moving forward. And you're doing it. You're doing it in a successful way. So obviously something you're doing is really, really right. And we like hearing that encouragement from you.
Yeah, so I'll talk a little bit about acceptance, and this is one that, especially early on after my diagnosis, that I really struggled with because I wanted to believe that I didn't have Crohn's or that it wouldn't impact me the way it has, or any of those things. So I think by our own human nature, we tend to fight the things that are uncomfortable or that put us in a position that we don't really like or that we don't want to deal with, which I think is entirely rational. It's understandable to want to fight those things that don't align with who you want to be or what you value. But at the same time, if you could, and I recognize this over the years, is if you continue to fight this futile battle, all you do is drain your own energy, you drain your own resources, and you're still fighting this battle that you have no chance of winning. There's actually a really great episode, if you haven't seen it, where it's on Disney Plus. It's where I found it. It's called Limitless. And there's this really great episode on acceptance and the actor that plays in Thor is the actor that is in the series. Anyways, I often talk about this particular episode because I think this is a great episode that conveys what it means to be accepting or what that can look like. Just a specific example from that episode, Chris is put in this suit that mimics what it is like to age and to be old. And we all intuitively know that we are going to get old, we're going to age, and inevitably we are one day going to die. Hopefully, most of us get to a nice old age and we don't pass until years later when it's our time. Not everyone gets there, but that aside, you can't fight aging. Aging is one of those things that happens whether or not you want it to. Same thing with
Right,
having a diagnosis that, yes, I have my diagnosis, but no matter how much I might want to change that, I can't change that. I can't just cure myself overnight. I'd love to be able to. That'd be great. But life doesn't work that way. So sometimes we have to realize that no matter what I do, no matter how much I fight this, I am not going to be able to change this for whatever reason.
right,
And that episode on acceptance where Chris was trying to fight the aging suit, he did. He got into it and thought, I'm going to beat this. I'm going to find a way around this. And he did. He would continue trying to move as fast as he could and seeing. So it's one of those suits that mimics extra weight on your body. You have to wear these glasses. It's like a helmet that has these glasses that makes your vision a lot worse, makes your hearing a lot worse. So it truly does mimic what it's like to be aging. And you might be able to get in and out of a suit, but the reality of what it's like to age, you don't just reverse aging, you don't change an illness, you don't just get cured overnight. So, what I've learned in dealing with my illness over the years is that if I continue to try to fight it, one, that's a futile battle for me to fight. It's again, it's going to waste my energy, and it's also gonna put me in this really negative space for my own mental health. I'm gonna feel like I need to continue fighting it, and there's no way I'm gonna be able to win this battle. So by learning to just accept it, as much as I may not want to live with it, it is my reality. I find a way to say, okay, this is how it is. I need to find a way to move on beyond this. What can I do now with my circumstances? It helps me explore other avenues and other opportunities and find ways for me to thrive despite my circumstances. And I truly believe that regardless of your circumstances, anyone can do this. Anyone can do this in any aspect of their lives. That chances are most people, maybe everyone listening to this podcast even, has some piece of their life that they're just not fully satisfied with, that they wish that they could change, but they can't for whatever reason. Maybe it's an illness, maybe it's age, maybe it's something else entirely. Maybe you just don't live where you want to live. It doesn't ultimately matter, but what does matter is that you learn that there are certain things you can change and certain things that you can't. But what are you going to do now in the here and now in this present moment to make your situation better? How are you going to strengthen yourself? How are you going to make your life better? How are you going to live life on your own terms? Or if you feel like that's not even feasible, what is one thing you can do today to start stepping in that direction so that you can start living life on your terms? And that's something that is near and dear to my heart. I often talk about financial freedom and building the career of your dreams. And I truly believe anyone can do that. But it does take being accepting of certain circumstances you can't change. It does also take making some action or being willing to commit to that action, whatever that looks like for you, and getting clear on that vision for the future. You may not be where you want to be today, but that
Mm-hmm.
doesn't mean that you can't work towards that. And what is one small thing that you can change today to get you one step closer to that?
Well, speaking of motherhood, and I've got to ask, man, I really have a very critical question I need to ask. Okay. We've been talking about motherhood, and I have a question for fatherhood here. Okay. I'd like to get your experience with it from a mother's perspective. I have two children I am trying to raise, and both of them are a pain in my you know what. Their names is Trevor Zalstra and Ruben Burney, and they give
What?
me a freaking headache all the time. So I need to know, what do I need to do to parent them better? Because I don't spank them, okay?
Hmm.
Boy, yeah.
Interesting.
There is no
What?
there is no
Where
a
did this
silver bullet when it
come
comes to
from?
parenting. But that said, there are certain things that I've learned as a parent. Sometimes too, it's recognizing in myself, am I in a position right now to do what I need to do for my children, or to, whether it's to hold them accountable or to hug them a little bit more closely or to kiss their boo-boos, whatever it is. And if the answer is no, then I might need to step away for a moment and catch my breath and then come back to it. So that is one thing that I've done. In fact, my husband and I are pretty good about balancing that in each other. I know not you can't always do that all the time. Sometimes you're in a situation where you're alone with your children, or it's not a safe situation. You can't step away. I get it. So if you can't do that, put your children, put yourself in a safe situation, take a step away, take a moment to breathe. It's okay. The kids will be okay for a minute, assuming everyone is in a safe position, and then come back to the situation with hopefully a fresh mind and a new take on, okay, what do I need to do here? And yes, there's a fine balance. I'd say there's, in my experience, a fine balance between holding my children accountable to, no, we don't throw food on the floor. No, we don't hit our sibling. And then there's a fine line of, okay, I'm sorry that that happened, that your toy got destroyed. I realize that's really frustrating. So finding that fine balance, and I wouldn't say it's perfect all the time. Believe me, I've definitely misstepped in certain places too. No parent is perfect, but it's finding that balance between that accountability for my children and then also that love and peacefulness and understanding, but also making sure that I'm in a good mindset to figure out where in that balance I need to be. And if I'm not, I might be too much in one extreme or the other. And my children need and deserve to have the response from me that I need to give to them. So it's not easy. It's not something that I get right all the time for sure. I can promise that I don't get it right all the time, but I do what I can to find that balance and give my children what they need in that moment.
That makes complete sense
Thank you for
because what
that. Now I know how to be a better father.
that makes good sense to me because what that explains to me is the fact that you've adapted as best as you can. You can continue moving forward, and um, it just seems to me that you're adapting and overcoming, and that once again amplifies the some of the mottos that I learned at a young age, and that's what helped me to not ever quit. And that's the same thing that I'm getting from you, and that's why I'm so overwhelmed with the amount of trying to break the stigma of dismissing this autoimmune disease that has to be gone through to be able to get to your goals, and you're doing it. You're providing an extremely wonderful example, positive on every aspect that I've heard you talk about so far. And it is extremely, extremely humbly, I'm grateful for that. What an amazing person you really are.
Well, thank you. I hope to
Absolutely.
impart some wisdom. That's my goal.
Well, you're
All
doing it.
right. All right, Trev, you want to go ahead and close this out?
Okay, with those kudos being off the chart there, the usual thing that we do here at the One Moment Podcast team is ask our guests about a call to action. A call to action would be just something that you consider to be like one of the most important and critical things that another person can do to help themselves get through dealing with this autoimmune disease, Crohn's. So go ahead, Miss Angela, and just give us what your insights will be.
Yeah, so I would say one thing to really focus on is just keep it simple. So I know we've talked about some pretty big things and some big changes and some accomplishments, but it starts with taking simple steps, simple actions. I didn't pay off $85,000 of student debt in 18 months by doing it overnight. I took small, simple, concrete actions step by step to just get me one step closer to doing that. So, by taking just one small step, whatever that looks like, what is the one thing you can do today to get you one step closer to the life that you want to live, to living life on your terms? Maybe it's if you want to pay off debt, for instance. This is just a specific example. If you want to pay off debt, well, do you know what your highest interest debt is? Do you know what the balances of your debt is? Maybe start by just taking inventory of those and being honest with where you stand today, even if it's uncomfortable. Or maybe you want to train for a marathon, but the idea of even getting up and going for a 1 mile run is just a daunting prospect. So maybe you get up and you start by going for a walk. Maybe it's a 1 mile walk, and then maybe that walk starts to turn into a half-mile run at some point, which then gets you ready to run that marathon. It's really the simple actions that are consistent and deliberate that really help you really achieve things on a grander level. And that's what I have done in my own life to have these bigger achievements. It didn't start by just figuring it out overnight and immediately doing these things. I took those simple actions, just got myself one step closer, one step closer. When you use incremental improvements like that, just do 1% better the next day, you can probably astound yourself in just what you can accomplish. I know I've certainly done that in my own life, and it doesn't have to be these big actions. It can be if you're in a place, in a position where you can and want to do that, but it doesn't have to be. In fact, very often it's kind of like the story of the tortoise and the hare, right? It's the tortoise that might be slow, but it's slowly continuing to move forward that eventually wins that race. Whereas the hare might be a lot faster, but is really inconsistent. It is that slow consistency moving you forward towards whatever direction you want to go that is going to help you achieve the results you're looking for. So if you're looking to make grand achievements, whatever that is in your career, with your family, with your personal wants in your own life, any of those things, just start small. And that's really all it takes. Just start to do one small thing and then just do a little bit better the next day.
Outstanding. Thank you, ma'am. Thank you so much for your time with us today, and we appreciate all the insights that you've positively shared with us. Kevin, do you have anything to add?
No, I am absolutely astonished at your experiences. And I'm glad that we were able to change the rhythm here. As you and I were talking about prior to the recording, you said that you rarely speak on motherhood, and you agreed to allow us to make it a first. And so I appreciate the opportunity that you have allowed us to let's dive into motherhood because it needs to be talked about more for sure. So I am humbled. Thank you.
Mm. Thank you.
Absolutely.